Welcome to Steeped in Wellness, brought to you by Matcha.com. Here we spill the tea on wellness trends, personal growth, and the latest health news. Now, here are your hosts, licensed dietitian Diana Weil and medical journalist Laura Hodgebateris.
Hello, everyone. Welcome to this week's episode.
So for this week's episode, we have our first repeat guest, Dr. Matthew Mosquera. Dr. Matthew Mosquera is a Harvard-trained, board-certified addiction psychiatrist and lecturer at Harvard Medical School. He provides high-quality, evidence-based mental health care through an open-minded, thoughtful, and dedicated approach. He is now working additionally in the ketamine treatment space as a regional director in Cambridge, Massachusetts. Welcome, Dr. Mosquera.
Thank you. What a warm introduction. Thanks,
Do
guys.
you feel like somebody just kind of wished you happy birthday or sang you happy birthday?
Oh, yeah, those are one of the best words I've heard in a long time.
Are you forgetting the most important part of the bio for our
I know,
purpose,
I was like,
Laura?
wait a minute.
Guys, I'm bearing the lead a little bit here, but if you're watching this podcast currently, maybe you can see the family resemblance between me and Dr. Mosquera. Dr. Mosquera is my brother, Matthew.
And they like each other. They're friends.
Yeah, we like each other. Yeah.
We do, yeah.
Yeah. So I guess Matt was previously on the podcast just kind of talking more broadly about mental health. And now we had said that we wanted to kind of go deep dive into ketamine because now that he's kind of specializing in ketamine treatment, it's kind of this up and coming thing that you're seeing clinics pop up all over the US. I just kind of want to roll back the tapes real quick and just I guess ask like, what is ketamine? Because the only association I really had with it up until a year ago was that it was a horse tranquilizer
That we used at
sometimes was
college
considered
parties.
a part. Yeah, that was like a party drug that would put you in a K-hole. So like,
Yeah.
what is it? How did it end up entering the health and wellness space?
It's a great question. So we can kind of give the whole history, which I find to be fascinating. I think that's one of the most interesting parts of ketamine, actually. So I give the spiel a lot. So if it feels canned, I'll try to make it sound a little bit more vivacious. So ketamine, it's been around for decades, guys. It was invented in the 60s by a U.S. chemist, this guy, Dr. Calvin Stevens. And at the time, he was working for like the biggest pharma group, definitely in the country, possibly the world, called Parke-Davis. Later got bought out by Pfizer, and his higher ups went to him. They're like, Dr. Stevens, we need a really good anesthetic medication. So meaning one of those meds you take before surgery. So he goes in the lab and he whips up ketamine. Fun fact, the medication that ketamine was replacing was actually PCP. Basically. So ketamine really is indeed new and improved PCP. And it works a heck of a lot better, as you can imagine. PCP was taken off the market shortly after its introduction. And it's a really good anesthetic agent because you could take a whole boatload of ketamine, either intranasally, intramuscularly, IV, all these different routes of administration, and you'll pass out more or less. Like you'll be ready for surgery. It'll provide pain relief, but you won't pass out. It really tends not to depress the respiratory drive. It is a very manageable half-life, meaning how long it kicks around in the body isn't too long, like really 2 to 4 hours compared to some other anesthetic agents that are really long acting. Doesn't have any interactions, doesn't have many side effects, short term, and then long term, quite negligible unless you start abusing it, like using it all day, every day, which we can talk about later. So for all those reasons, it's been used in medicine, in like emergency rooms, operating rooms around the world for both humans and animals. So like the fact that people think of it as an animal tranquilizer, that is entirely accurate, but the doses for horses are like 10 times or more for like than compared for humans, which makes sense.
So if you go get like surgery, like let's say you go get like wrist surgery, are they going to give you ketamine as their preferred choice?
Usually not. Usually for I mean, that being said, in the emergency room for like, if they have to reset like so if someone's shoulder gets dislocated and they need some quick, easy pain relief slash, mild anesthetic, yeah, they can give you ketamine. You may not pass out, you may just like kind of dissociate and like not even realize it's happening, but it's used. Like emergency room doctors, physicians are super comfortable with it for all those reasons that I listed, because it is quite safe, which is the nice.
Propofol is the more common one, right?
More heavy duty. That's one that's really going to put you out. And that's typically given intravenously, whereas ketamine, they can give you a shot. They can do it intravenously. What we do in the clinic is a lot of intranasal, all these different forms.
Yeah, so when we're taking ketamine outside of the operating room,
Mhm.
how exactly does ketamine therapy work?
Yeah, for depression.
I guess, yeah. Well, is that usually the primary way people are using it, like as far as mental health goes?
I'd say it's what has the most efficacy at the moment, and it's what it's FDA approved for. So whenever we're talking about getting a medication out to the masses and having insurance cover it, somewhere people can really have access to it, it's really what the FDA is going to approve. So remember, so ketamine came on board in like the 60s. It actually rose to fame on the battlefields of Vietnam, and then throughout the years, has been widely used. I just love the history, as you can tell. And then we didn't really start looking at it for depression until the late 1990s, early 2000s. And then it wasn't approved for what's called treatment-resistant depression until 2019. And then it got the secondary FDA approval indication for, I might botch the exact terminology, but essentially a major depressive episode with suicidal ideation or behavior. Basically, a really bad depressive episode where you may have some suicidal ideation. So those two approvals, that's what the FDA approved Esketamine for. That's the insurance-based nasal spray. And then I can jump into the way it works, but there is kind of some confusion these days, like what is esketamine versus ketamine? You guys?
Yeah, that doesn't mean anything to us.
Yeah, I didn't even know that there were
Different
multiple.
ketamines.
Yeah.
Okay.
Teach us.
We'll try to break it down. So esketamine is a version of ketamine. So just like we have, to explain this, like a molecule, you could think like the ketamine molecule, it has a left-sided configuration and a right-sided configuration, just like we have a left hand and a right hand. These are both hands. One is a right one is a left one, right?
For those of you listening on the audio, Alara's holding up her hands to demonstrate. Okay.
Yeah. So ketamine, the one that I've been talking about, that's been around since the 60s, it's generic, it's widely used. It typically comes in a combination of both the right-sided and left-sided configurations, aka what's called a racemic mixture of the levo and dextro forms. So what they did when they wanted to create a nasal spray that they could get a patent on is that they isolated the configuration of ketamine that is most active at the receptor that we really want to emphasize. That happens to be the NMDA receptor. So ketamine, one of its many mechanistic properties, it is an NMDA receptor antagonist, among many other types of elements of the mechanisms that are important. Esketamine is really just the levo enantiomer of ketamine that's separated from the right. It's a little bit confusing, so if I lost you there, let me know. I could always go back and clarify.
I want to see if I understand this correctly, and I feel I can call you Matt since this is your second time on the show as opposed to Dr. Mosquera. But so the S-ketamine isolates the most effective for this purpose part of the overall ketamine. Do I have that right?
You got it. Yeah, nailed it. That's exactly it. Yeah. I will say that there is some research right now looking at the other configuration of ketamine, the dextro form of ketamine. It has not been approved. It's still very much in clinical trials, but they're looking at that as well for maybe some other applications across medicine, including depression and mental health. But nothing yet. So what we got is esketamine, and it works pretty well.
And that's obviously been FDA approved for depression, but I've also seen that they're using ketamine to treat OCD, anxiety, bipolar disorder, migraines, but that isn't necessarily covered by insurance. But can you go to a ketamine clinic and be able to receive ketamine for those other things, like if it isn't depression?
Usually, yes. So all those other indications would be considered off-label uses for ketamine. That being said, usually then if you're going to a clinic and you're seeking treatment for an off-label use such as OCD, such as anxiety, such as PTSD, which by the way ketamine has some promise for, typically that wouldn't be the esketamine, that nasal spray, just because that's more just for the depression piece, because insurance will cover it. So if you're looking to get treated, let's say for PTSD exclusively, you may get either the intravenous ketamine or intramuscular ketamine, that mixture one. Again, it's been around since the 60s.
So could I just walk into a clinic and be like, hey, I have really bad anxiety. Will you treat me? And what would be the cost for going for an off-label use?
Yeah, so you can't just prance on it and demand it, but you meet with the doctor. They would sit you down. You would kind of run through your history. If they're like, yep, Diana's got true blue, generalized anxiety disorder. It has some promise for that. Let's give it a go. They'll run through the risks. the experience with you, and then it usually would be an out-of-pocket cost. Different clinics have different costs. I'd say 500 minimum per treatment is kind of the going rate here, and that's more for intramuscular. If we're talking intravenous, a little more involved, having to put an IV in, that's going to run you close to like $1,000 a treatment. Granted, that's just kind of a ballpark. All treatment centers do it differently. They offer package deals. They offer therapy at the same time, which we can talk about. It's called Ketamine-Assisted Psychotherapy. But yes, so you definitely get an evaluation and then pay out of pocket for those off-label uses.
That takes us back to the question of how the FDA-approved use does work, the esketamine for anxiety, depression, or walk us through how that works, if you would, please.
Big picture, it plays on our brain's ability to adapt. Like, have you guys ever heard of the term neuroplasticity?
It is, but could you explain that term real quick?
Totally. So neuroplasticity, if I did distill it down, it's just that our brain can adapt. But the important part of this is that our brain can adapt in healthy ways and maybe not so healthy ways. So like not so healthy ways, you can think of, someone that begins to use alcohol as a coping mechanism. Our brain's going to adapt to that, and then it's going to become dependent on it, and our brain's going to look to it. A healthy way is think about developing like a healthy new behavior. Like you really get into working out, at first it's painful, and then it becomes more muscle memory, and it's something that you do every day without even thinking. So our brains can adapt at various levels, and one of the levels that it can also adapt at is the structural level. And it can change. It's plastic. It means that it has ability to kind of do different things. So what we're going to focus on is this concept in the brain called functional connectivity, which is kind of how our brain regulates itself. We have one area of the brain talking to another area, kind of a lot of crosstalk. The more crosstalk, the better generally. And the brain kind of wants to remain at even homeostasis. So you can think of the brain as kind of a checks and balances type system. And when there's more crosstalk, the better, because then our brain better regulates itself. And then we are better able to regulate our own emotions and just like feel different emotions. So unfortunately, when you're in a state of stress, like a depressive episode, some of those synaptic connections, that's how the different neurons in our brains talk to each other, they wither away. They're what's called stress sensitive. So then our brain in that state of stress is really struggling to regulate itself. And then we, as a result, are struggling to regulate our own emotions and quite frankly, just like feel different emotions, which is why when you're super depressed, it can feel like you're in a dark hole where you're like, gosh darn, I want to feel differently, but I can't. I'm just stuck. It's because physiologically, your brain is struggling to regulate itself and there's not a lot of crosstalk and it's hard for you to feel different emotions, like almost physiologically. So ketamine helps reverse that. At the end of the day, through this whole mechanistic cascade, which we can dive as deep as you guys want, ketamine actually goes to the ends of our neurons, revs up protein machinery to form new connections. So then our brains can better regulate itself. There's enhanced functional connectivity, and then we can better regulate our own emotions and feel different emotions pretty quickly.
In your opinion, do you think, how do you feel about it being used for OCD, anxiety, that kind of stuff, not just for depression?
I think it has some promise. What I can tell you is what I've seen. There hasn't been too many studies published which are leading the charge about for ketamine or esketamine getting approved for OCD or anxiety, but it seems to help. We have a lot of folks come into the clinic who have true blue major depressive disorder and generalized anxiety disorder. For whatever reason, the depression tends to lift first. And then all too often, depression lifts, people are like, oh, I feel better, but my anxiety is now in the spotlight. And the kind of the party line here is that we're like, hold on, it tends to take a little longer for the anxiety symptoms to quell a bit, but they do with time.
So this brings me to my question of, how often are people doing ketamine treatments? Are they coming in weekly? Are they coming in for just one big dose? How does that process work?
So what you're getting at is what's called treatment durability, right? So the jury is very much still out on treatment durability, meaning that whole mechanism that I just described. It sounds pretty cool, but does it last for 5 minutes, 5 days, forever, even after one treatment? We're still figuring it out. But when it was approved, generally when folks start on the insurance-based nasal spray, the Esketamine, or if somebody's coming in for intramuscular, typically you start by coming in twice weekly for 4 weeks. as part of the induction course to kind of kickstart the growth of these new synaptic connections to make them go from, non-existent to at least semi-permanent. And then from there, a lot of times folks wind up coming in weekly for some time until their symptoms have stabilized, and you can kind of remain on it weekly and maybe come off your other meds or taper off the ketamine, with the hopes that you've been able to get some benefit, and pair it with other lifestyle interventions that are essential.
Yeah, I'm curious about that. You mentioned that this helps to build new synapses. So what you're doing while like during those 4 weeks, is that critical? Like if you choose to drink a lot, are you then going to be could you make things worse for yourself rather than better depending on what you do during that time?
Yeah, like is there kind of a no-fly list? Like, please don't do this while you're in your
Yeah.
month concentrated ketamine treatment. Like, please,
Yeah, that's a good question. So strong, strong recommendation to not abuse substances, or even, I mean, if you can avoid using them altogether during treatment, your chance of it being efficacious and actually effective is certainly like way higher, because it's just going to make it that much harder for those new connections to form. And substances really kind of make it harder for us to regulate our own emotions. So you're kind of just shooting yourself in the foot, if you're using substances alongside the esketamine treatment, or ketamine treatment rather. Um, so other things you can do to make it more efficacious is to pair it alongside. Doing your best to develop some sort of an exercise regimen, even if it's just like 5 minutes a day. Consistency is key here. Trying your best to practice like proper sleep hygiene, trying your best to eat a balanced diet, and then meet with a therapist. Because I view all these things as kind of like a piece of the puzzle, and ketamine at the end of the day is just another tool for you to use alongside all those other interventions. And if you pair it with them, there's this beautiful synergy that happens, where you're able to engage in them more readily with higher level of motivation, higher energy level, and then it kind of becomes the norm.
So can you walk us through what an actual ketamine treatment session is?
I was just going to say that. Yes. Yeah. Tell us the experience.
Yeah, like and I know that you've mentioned now, so there's like you can do it with like just the little nasal spray or intravenously, but just kind of
Yeah.
walk us through what that experience is like, what someone could expect.
Let's talk about it, maybe expectations, which is always a big one that people, it's really important. So the experience, it's different. It is what's called entering like an unordinary state of mind. At the clinic that I work at, we have private treatment rooms. It is a medical clinic. Try to make it not feel like one though. Try to make it very comfortable, very safe space where staff gets to know the patients get to know the staff. Full blackout shades in the room, very comfortable chairs, weighted blankets, blood pressure machines. We monitor oxygenation. So you come in, and the nasal spray is actually administered by the patients themselves under kind of the guidance of staff.
Mhm.
And once I kind of break down each treatment is generally 2 hours long. I break it down to the active phase and then the recovery phase. So the active phase is the first 40-ish minutes or so. And then you get to the peak, and then you kind of come down to the recovery phase. During the active phase, after the client has administered the intranasal ketamine, or if the staff member has provided the intramuscular injection or the IV infusion, and by the way, the IV and the IM formulations kind of hit more quickly, so you kind of want to be really ready. Whereas the intranasal kind of is a little more gradual on, gradual off, could be a little more gentle in that sense. But the active phase is notable for, you're going to experience some dissociation, which is this term for kind of an out-of-body floaty experience, as I call it. You're not going to forget who you are or where you are. It's not going to be that intense, but it is going to be a little bit of a disconnection. And for some, this can be startling. For others, it's like, bring it on. This is great. I've been looking for this. Along with it, you'll likely experience some visuals in the form of a kaleidoscope of colors. To really kind of experience the visuals, that's why we recommend eye shades. We recommend very chill ambient music. We have playlists that we offer here at the clinic. It pairs nicely.
Like a wine.
Now, is anyone speaking to you as this is happening? Like, okay, so I go in, right? I'm in a dark room. Am I covering my eyes, putting something up my nose, and then someone's in the room with me? Are they talking to me at all? Are they like, hey, Laura, are you good? Like, what's happening with you?
So there's different ways of doing it. So if you were entering into what's called ketamine-assisted psychotherapy, you would have a provider in the room with you the whole time, the full 2 hours. Most clinics aren't staffed like that. Like, our clinic isn't, but we do check-ins at the beginning. We have call bells to come in the room if someone's having a hard time or a great time, or if they just want a snack delivered, or a beverage, quite frankly, really whatever they need, and then we'll
Does
do
that
a check.
happen a lot? The people like, are they just like, I'm parched, or like, I really want some Doritos?
We aim to please. We try to make it a comfortable experience. So yeah, that's the easy part, and people are typically very happy to see you and appreciative. So generally, no, because during the active phase, it's a very internal type experience. Like all the different psychedelics on the map, and I'll kind of lump ketamine in with the other psychedelics for the sake of this, like LSD, MDMA, psilocybin. They're all like different houses on the same street, right? They have
Hmm.
similarities, but they're also different in that, like, psilocybin is more of like an external experience. You want to go out and go on a hike and experience nature and be with people. Whereas ketamine, during that active phase that I described, it's quite internal.
And how long did you say that is? Like 10 minutes, 20 minutes?
40 minutes, right?
40, but like the really kind of intense-ish visuals would be like 20 minutes. And that's the beauty of ketamine. If the visuals with associations a little bit much for you, you can just remind yourself, well, you know what, in like 10 minutes at this point, it's probably going to be over. And then, it's going to fade away. I'll come back into my body, and then experience the recovery phase, which is typically quite pleasant. You have kind of a runner's high, because one of the mechanistic properties of ketamine is that it's like an allosteric modulator, which is a very confusing term, but it tinkers with the endogenous endorphin system in the body. So you feel good from that. And you have kind of like a runner's high for the last hour.
So you know how I mean, maybe this is totally different, and I guess it just depends on the drugs. But you know how like sometimes if you do something, the next day is not so fun. Is it like a runner's high for everybody, or do you have anyone who could potentially feel worse from that like experience?
Potential side effects that come along with ketamine therapy.
In session, I'll just talk side effects. In session, those visuals can be a little dynamic. So for some, if you have like a propensity for motion sickness, like on a boat or a car, we can give some anti-nausea medication ahead of time. Some folks get a little nauseous. And then afterwards, I say the more common would be the next day, you may experience a little bit of grogginess, a little bit of fatigue.
Mm.
Folks tend to kind of acclimate to that. They kind of get used to it. That being said, if somebody's having like dysphoric reactions, like really feeling low after treatment, we're going to watch them closely and decide if it's the treatment for them. It's not the norm, but it is something that we look out for.
And can you talk about if people are doing I think you called it therapy assisted ketamine treatment? What does that look like? Do you do the ketamine treatment and then go meet with a therapist? Or is that like a separate day?
So it's typically the same day, ketamine-assisted psychotherapy. I want to be sure, but this is typically not covered by insurance. So CAP,
Mm.
it's called ketamine-assisted psychotherapy, the acronym CAP, is provided by a lot of clinics. A lot of clinics do it really well. It's just going to be an out-of-pocket cost where you'll have a provider in the room the full 2 hours. Who knows? Maybe the first hour you guys aren't talking; they're just kind of hanging out there with you. If you need them, they're there. And then during that recovery phase, you'll kind of come back into your body, and you'll be able to engage and talk about what you just experienced, and start integrating.
Have you ever witnessed someone having like a pretty funny reaction to the ketamine? Like, I don't know, like they like uncontrollable laughter for like a 40-minute period. You don't have to answer it if you don't want to, but just
I'll put it this way. I'd say we get far more of those, kind of just like an ecstatic, really like jubilant, kind of this is great. We have a lot more clients saying I just had a great session, compared to folks being like that was the worst time of my life. We rarely hear that. Have we heard it? Sure. I think that's more triggered by someone's mindset going into it. So we really do try to
mm,
pay special attention to set and setting, both mindset and the environment. So when we meet with clients, especially for the first couple of visits, we'll pay special attention to their mindset going in. And if somebody's got a negative mindset prior to treatment, we'll hold off. Maybe today's not the day, because if they're kind of dead set on it being a horrible experience, it's not gonna be fun.
It's interesting. I think of a family member I have who she doesn't like to lose control. She's never been more than buzzed off of alcohol. She's never been drunk. She's never tried marijuana, cannabis, any of that stuff. I feel like this would not be for her.
Maybe not. I think we would have to coach her up a bit and really make her feel as comfortable as possible. But your description, John, makes me think of this is where dosing does come into play. So classically, the first day for the intranasal, we provide a reduced dose just as kind of like a test to see how it goes. And some clients, that's all they need. But there is a certain element that if you don't provide a high enough dose, you may not get the therapeutic benefit, and then you may just get some of the unordinary state of mind without the upside. So if somebody is underdosed, we typically try to make sure that we've at least tried to provide a adequate treatment dose before we deem it a success or failure.
So why would you pick ketamine versus like going to a psychedelic assisted therapy program and doing like mushrooms or, I think, I guess mushrooms would be the only one that else is legal.
Think of like mushrooms or going and doing ayahuasca.
For one, insurance can cover it if you're eligible for treatment-resistant depression. So you don't have to break the bank, because all those other places that you just, whether it's a psilocybin center or therapy with it, it's going to be out of pocket, and we don't want people to break the bank. And if it's something that works, you want them to keep having access to it so then they can continue to feel better. To be on for the rest of their life, but if they're going through a tough time, you want them to be able to utilize it. And then in addition, I find that ketamine is really manageable. The half-life, right, like that I mentioned earlier, how long it's in the body for is not too long. Whereas psilocybin, ayahuasca, you're talking psilocybin, it's going to be 6 hours or more. And then for ayahuasca, we're talking like full-on daily situation there where you have to.
Okay, I have to ask, what is ayahuasca? You guys have mentioned it. I've never heard of it.
John,
You don't know what ayahuasca? Oh, John,
I'm sheltered.
no, you explain, yeah, other than like, puking in a bucket and seeing
Well, it's
ghosts,
like a very
I don't know.
Sounds awesome.
sacred to
Yeah.
Peru, I think. Anyways, Matt, you'll probably do a better job.
Yeah.
Sure. So ayahuasca generally, and this, I'm not an ayahuasca shaman, so I'm kind of shooting from the hip here. It's a psychedelic brew. It's made from this plant. I think it came from the Amazon. It's been used in like traditional healing ceremonies, usually in South America. But the main ingredient, kind of the psychoactive component, is this chemical called DMT, which is also known as like what our body releases when we dream. And it's a very intense experience. So DMT stands for dimethyltryptamine. And yeah, it's pretty intense. It is, when folks experience it, they're really going to have this profound dissociation. Everything, it's kind of like ketamine, but everything is going to be much more profound.
So it's like that flower in Black Panther.
Yeah. Yes. Yeah.
Yeah.
There we go.
Yeah, actually, yes. Yeah.
For a second, I thought that I was getting lost because I got silence for a second, and then it all clicked for all three of you at the same time.
And I was like, that's how
Yeah.
they got their power. Yes. Similar.
Isn't DMT the chemical that's released when you're born and when you die? Is that true, or is that just a myth that they tell?
Same. It's
people?
the same. I think, yeah. And in theory, yes. So it's all kind of similar in that sense. There is some psychedelic research into more like manageable forms of DMT that don't, involve purging, because one of the ayahuasca components is that a lot of times people will throw up during it. It's almost like a necessary part, and it can be quite destabilizing if you go into it without kind of a really stable kind of mindset of what you're looking for and a lot of safety wrapped around it, because I think the side effects are a little bit more intense than ketamine. Ketamine is a lot more gentle, a lot easier to manage in a lot of different ways.
Who would you not recommend ketamine for?
It's a great question. I would not recommend ketamine to someone who has a history of some sort of primary thought disorder, which is another term for like schizophrenia, schizoaffective disorder, someone that's been struggling with that, because there is some like psychomimetic effects, meaning that like the visuals that I just described, that's because there's some dopamine receptor agonism. It kind of fiddles with the dopamine receptor, and that can worsen, theoretically, somebody has schizophrenia. It could have them hear more voices, more intense visuals, and really throw them off. So that would be a no-go for me. Someone that has profound liver dysfunction, someone who's just had a heart attack, someone who has a history of seizures is not a complete contraindication. Ketamine isn't really known to trigger seizures, but we don't want to really mess around because it is a little bit of a strain on the body. Ketamine is. So someone has a history of seizures, we want to chat with their neurologist ahead of time, make sure they're on the right meds, and that we can watch them closely. Those are just a few off the top of my head. Uncontrolled high blood pressure is another one, which is probably the most common one that we see. So ketamine increases blood pressure for everyone. Young, old, big, small, doesn't matter. It's the equivalent of if somebody walked up a few flights of stairs. It happens, it kind of peaks at that midway point, and it comes back down generally. So if somebody has poorly controlled high blood pressure, we're going to recommend, hey, go see your doc, maybe get started on a med and come back, just so we can be completely safe with everything.
Matt, in terms of course of treatment, I know sometimes SSRIs, if you go on one, you might be on it for the rest of your life. I know sometimes folks go on one if they're going through, as you mentioned earlier, a really particularly hard time, temporarily. This ketamine treatment, I know we're kind of early in the game here. Is it typically a shorter, medium, longer term treatment, or does it depend on the individual?
It depends. It depends. And we're still early in the game. There was just in the American Journal of Psychiatry just this month, they released a few articles on like long-term efficacy as well as side effects. And kind of the conclusion of a lot of them was we need to keep watching. We need to keep studying folks. We need to keep seeing gathering data on these long-term effects. So we have a good amount of clients, John, that wind up coming off their SSRIs and remain on ketamine just because the SSRIs have these side effects they don't like. Some side effects, like whether it's nausea, headache, or sexual side effects, which are quite rampant with SSRIs.
Lack of sleep, lower ability to drink alcohol, or like one or two drinks knocks you on your butt. Yeah, I've heard a lot of that with SSRIs.
Yeah, so there's a lot of side effects. A lot of people can't tolerate them, so they prefer to remain on something like ketamine.
What about patients bringing ketamine home from clinics? Because I know, right, they're
good topic.
like Matthew Perry. Matthew Perry just keeps popping into my mind.
Oh,
The
is that what he
overdose on
died of?
ketamine. He died of a ketamine overdose. Yeah.
Let's clarify that. I'm glad you brought that up. First off, Spravato, the insurance-based nasal spray, is very tightly regulated. The vast majority of our clients here receive Spravato because insurance pays for it. We store it here very safely. You can only administer it in a medical clinic like our clinic here. You cannot take it home. You cannot
For
buy it
the
off
state of Massachusetts, or is that
or
countrywide?
America or the United States of America. So that's a good thing because it keeps it above board and makes it ensures that patients are coming to a safe place with medical attention to receive this treatment. If anything goes awry, you can immediately get tended to. In my opinion, in strong opinion, it's the best way to do it. There's a lot of mail order companies, Mind Blooms of the world, that's just the one off the top of my head, or just honestly meeting with a private practice provider where they can prescribe you ketamine and you can pick up a vial or lozenges in all various forms, and they'll instruct you how to administer it yourself at home. As you can imagine, that can quickly go awry if somebody starts misusing it, using too much, or accidentally uses too much, and that has an adverse reaction. A lot of bad things can happen. So there are some spots that are able to do it, but I think it's quite risky. And then Matthew Perry. So he did not die necessarily of a ketamine overdose. He did have ketamine in his system. And like I mentioned at the start, ketamine really doesn't suppress the respiratory drive, even at high doses, but you'll pass out if you take enough of it. And he unfortunately passed out in a spot that you can't.
In a jacuzzi, right? Wasn't it a jacuzzi?
In a body of water. So you don't want to pass out in a body of water.
Yeah, don't do ketamine in a body of water.
He was getting ketamine from an outside provider, so who knows how much he was using. Whereas if he was receiving it at a clinic, obviously it'd be a different story.
It reminds me a little bit, you talk, I don't want to stereotype about Los Angeles and doctor shopping and whatever, but we mentioned propofol earlier. That was what Michael Jackson died of because he had a private doctor that, if you remember, he would call it his milk. I need my milk to go to sleep. And he had this doctor who would give him propofol every night so he could sleep. I mean, terrible misuse of the intent of that drug. So again, we don't know what happened with Matthew Perry. I don't accuse anybody of anything, but if you have means and fame, you can get access to things that you maybe shouldn't have access to.
Totally agree. That VIP level of care, you think you're getting high level of care, but when you go outside of standard treatment norms, bad things can happen.
Alara, you had told me when you were pregnant that you were going to consider doing ketamine postpartum. And is that something that you have done? Do you still want to do it?
I haven't done it. I told myself it would be on the table if I felt myself dipping into feeling postpartum depression, which this time around I have not, as of late. Could that change, a week from now, a month from now? Possibly. But overall, I have to say, my son Archer, who's now 3 months, he's just been a lot easier of a baby compared to my first. not to say that co was like a hard baby, but the first time around, right, you have no idea what you're doing. Everything's just kind of heightened. You're stressed. You're just like, I don't know anything that's going on. So you inevitably just like have much less downtime.
This is a
So
perfect time for a callback to our before and after episodes for after Archer, before and after Archer was born with Laura. I'd encourage our listeners to go back and listen and watch that episode.
yeah, absolutely. But at this point in time, has anybody come into the clinic kind of seeking out ketamine specifically for postpartum depression?
And can you do it postpartum? Like, what are the rules around that?
Yeah.
Sure, that would be another off-label use where you can kind of treat, a depressive episode triggered in the postpartum setting. You just have to have a provider evaluate you and monitor you closely. It would be more of an off-label use, so you wouldn't be eligible for the insurance-based nasal spray, but sure, you could try it. And I'd recommend coming into a clinic to do it, so you're doing it as safely as possible. But there's some promise there.
What about breastfeeding? Can you do it while breastfeeding, or is that contraindicated?
Generally, no. That is one of the questions we ask. Like, are you pregnant or trying to get pregnant or breastfeeding? It just really hasn't been studied. Not necessarily. It's not a known teratogen, meaning like something that's going to be harmful to a fetus if someone's pregnant. Let's say. We just don't know enough. And in the world of not knowing enough when it comes to pregnancy or breastfeeding, we just kind of steer away from it, unfortunately, unless you've tried everything else and you're in rough shape.
So now going back to at the clinic, what type of license do people have in order to administer ketamine?
Great question. So any MD, if somebody has an active medical license, they're certified with the DEA, and they have a DEA number, you can provide it. You can prescribe it to patients. Yeah, you basically just need a DEA license, and then you have to document why it's indicated, what you're going to monitor, that you've reviewed side effects, and whatnot. So documentation is key, and having an active DEA license as well.
But is it always necessary to have a MD, right? Is that the person who's leading you in and out of the room, answering you when you ring your bell?
Technically, no. Technically, some places and nurse practitioners can also prescribe it because NPs can have their own DEA license unique to them as well.
So what made you want to go into this? Like, what about ketamine therapy is interesting to you?
In a funny coincidence, before I worked in the space, I actually went to a conference, the American Psychiatric Association, the APA conference. This was back in New Orleans, I want to say like 3 or 4 years ago. And I heard this psychopharmacologist, Dr. Steven Stahl, give a talk on the mechanism of ketamine. I was just fascinated by it. I'm like, wow, I did not know that's the way it works. I've always heard about this thing growing up. It was this big spooky entity that people use as a drug of abuse. So like, I was trying to keep an open mind. And then I learned more about it. I just decided to look into it. And it turns out that it helps people. It wasn't until I heard from patients themselves as far as their before and after and their experience that it really won me over, because you have a whole bunch of patients across America that have had super bad treatment resistant depression. They've really been struggling, life upended, and then they find this treatment and it really helps them quite tremendously, and they feel differently pretty quickly. And in the world of mental health, the world of medicine, if you can provide a treatment that really helps people that quickly, it's a win-win.
Matt, I know it's going to be different for every patient and every situation, but what are some reasonable expectations for efficacy of the ketamine treatment?
Yeah, this is one of the most important topics that I review with everyone that comes into the clinic, just to kind of get everyone on the same page. And I'm very straightforward with it. I sit folks down. I'm like, look, let's talk about what ketamine is not. Ketamine is not the kind of treatment where you're going to have some big revelation of why you feel the way you feel, why the world is the way it is. That is just straight up is not going to happen. Maybe that'll happen if you do like an ayahuasca trip, but it will not happen with ketamine. Sometimes folks are disappointed, but then I flip it. So I'm like, look, what you can expect is an opportunity for a mindset shift, to start viewing the world a little bit more optimistically with a little less pessimism. And if that takes root, suddenly motivation ticks up, energy ticks up. Life will still be hard. Life's always going to be hard, but hopefully it's a little bit less hard. And it has this gradual snowball effect to kind of have that mindset shift.
Can you talk about using it as a party drug and what a K-hole is? Because that was the way that I knew ketamine when I was in college.
You had a more exciting college life than I did.
So as an addiction psychiatrist, I have a special interest in this, and I want to pay special attention to it, and I've looked into the numbers, and it is on the rise as far as like a drug of abuse misuse, for various reasons. And folks, it's a funny party drug in the sense that at low doses it can be kind of stimulant-esque, and then at higher doses you get that profound dissociation where you kind of enter a K-hole. As far as the treatment doses we provide here, is probably somewhere in between those two experiences.
What is a K-hole?
A K-hole is like I talked about, that kind of that out-of-body floaty experience. It's an intense version of that, where folks are really kind of they're sedated, they're still breathing, but they're kind of separated as far as mind and body. It doesn't last very long. Once again, it's going to last for 20-30 minutes and they'll come out of it. But it's usually pretty intense.
Yeah, I've seen people at parties in K-Hills where they're in the corner, they're sitting there, they're kind of just staring off into space. They may be heavily sweating, maybe not. They're nonverbal, they're just kind of like a bobblehead just hanging out. And then they just it's like they just come back too.
Can I ask a tangent question here with your background as an addiction psychiatrist, Matt?
Yeah.
Is it true, I've seen anecdotal evidence that Gen Z college-age students, they're not drinking as much anymore. And maybe it's because, cannabis is more readily available in a lot of places, but, and we're talking about these party drugs. Like, I go back to my alma mater at Syracuse, most of the bars on campus are closed. Like, these kids are not drinking anymore. I feel like they're doing other things. Have you seen that in your line of work?
I think so. Like, the rates are definitely on the rise in youth populations, especially. I think it's a variety of reasons. I think the youth pop maybe is ahead of the Gen Z, the baby boomers, realizing that alcohol is also quite toxic. Maybe they're onto something here, but I guess they're looking for some other vices, and ketamine's popped up, given that I guess cocaine use is, I'm not sure the exact rates, but there's been a lot of talk in the media of it being spiked with fentanyl, and doesn't appear that the ketamine there is as much. I could be wrong, but that's just kind of what we've been hearing. So I think that also contributed. So kind of from both these other substances that maybe they would have used are not as popular. So then ketamine has kind of filled that gap. And it's, I don't want to say, as far as a harm reduction standpoint, I think there's far more destructive capability of some of like these cocaine, fentanyl, obviously, compared to ketamine. But to get to your question, it's on the rise, and it's something that I definitely take note of, because that's where you see the long-term side effects of ketamine for these daily users. Like at the dose and the frequency that we give ketamine in the clinic, long-term side effects are largely negligible. And I counsel patients on this a lot. But if you start abusing ketamine, using it, every day, that's when you're going to get inflammation of the bladder, this ulcerative cystitis, these abdominal cramps called the K cramps, and then some headaches, because too much of that neuro enhancement isn't a good thing. So you get these things called Olney lesions, which are these kind of semi-permanent areas in the brain.
Jeez.
Of dysfunction. So yeah. It's on the rise, something that we take note of, which is all the more reason why I appreciate that that clinics like the one I work at exist, so you can kind of provide the treatment the right way and do your best to prevent misuse.
Now, where do you see ketamine therapy heading in the next 5 to 10 years? Is there going to be a big shift in any direction that comes to mind?
Yeah, I get asked that a lot. I don't think it's going anywhere. That's the first question I had to determine for myself, just because it works. It's safe. It works quickly. It helps folks to feel differently. Not overnight, but within the induction course, within 4 weeks, for a lot of people that have been just craving to feel differently out of this kind of depressive funk for quite some time. And I think if administered the right way, it's going to have a role in psychiatry, mental health for the foreseeable future.
What's your thought on at-home ketamine programs versus in-clinic treatments?
I am biased. I think you can do them possibly well, but at the same time, it's higher risk. It's higher risk. It has to be, I think, for a select few, I think it's appropriate. But for the vast majority of individuals in clinic, I would strongly recommend.
Do people ever come in and do ketamine together? Like, do you ever have, like, say,
like a
couple
couples
come in,
therapy?
right? A couples therapist, right? They're like, instead of a couples therapy session, like, we just want to come in. We don't want to go see a couples therapist. We're having marital issues. Like, let's just go do ketamine together. Like, is that an option? It's just like when you go in for a couples massage.
Haven't provided one yet. It's a cool idea. And there may be some promise there. We're not set up to do that exactly. There's one chair per room, but hey, you never know in the future.
Okay, I feel like we got to wrap up here soon, but I have a question for you. Like I am someone who I can handle a buzz, but I can't do any other substances because it brings up so much anxiety for me. That feeling
Yeah.
that like those psychedelics just really don't mesh with, I don't know, my brain, I guess.
Yeah.
So would you like someone who maybe has a lot of fear or anxiety around like any sort of psychedelics, what advice would you have for someone who's maybe interested in ketamine but like, has that fear and anxiety?
It's a great, great question. And I get asked it a lot. So, what do I tell folks? We do our very best to provide psychoeducation prior to the treatment. I find that knowledge here is power, just to help try to reduce as much uncertainty as possible. Of course, going into it, it can be this kind of big, scary alternative state of mind for someone that struggles with control, and letting go of it can be quite triggering. So you do your very best to coach them through it. You also try not to give too high of a dose because then it's going to be a little bit too much, but you don't want to underdose either. So you also coach around dosing and what you're gonna provide the lowest dose that you need to get the effect that you're looking for. And then you could always try it. The beauty of ketamine, it doesn't last for very long, and if somebody's not having a good time in the treatment session, we can come in the room, put the shades up, put the feet on the ground, do some breath work, do some grounding skills, provide a cold pack, and folks typically tend to regulate pretty quickly. So it is not for everyone, but it's for a lot of folks, even folks that are quite trepidatious going into it. So working with a really strong group of providers, folks can kind of coach you along the way, is essential. So you can imagine if you have that mindset and you're trying it out at home, probably not a recipe for success. So that's why clinics are important.
John, do you feel any urge to do ketamine at any point in your life after this podcast?
You know what? I'll be honest. I had only heard of it as a party drug or something that people had abused before this conversation. And I have issues with anxiety, and I have been on an SSRI for about 10 years now. So I have found this conversation absolutely fascinating.
Matt, we're going to bring you through just a couple really fast questions, shoot off the hip in terms of the answer here, so we can just kind of like move through them. Diana and I will just kind of pivot back and forth. So, fact or fiction? Will ketamine clinics be as common as yoga studios?
Fact.
Okay, fact or fiction, the benefits fade quickly after treatment.
This is what I want to say. It depends on the patient. I can give a long, in-depth answer, but I'm going to say actually fiction, because what separates ketamine from the rest is that you're going to have this long-lasting effect if done correctly in an ideal.
Fact or fiction, everyone experiences vivid visuals as you described earlier.
I'm going to say fiction just because the vast majority do, but the vast majority does not equal everyone. So most do, but not everyone.
Okay, fact or fiction? You need to set intentions and go in with a good mindset before a session.
Fiction. That
Oh.
said, setting intentions is an essential piece for some of our clientele, but for others, it can feel like added pressure. So
Fact or fiction? Every time you go in for a ketamine session, you need to be doing more ketamine each time.
fiction.
Interesting. So you won't build up a tolerance necessarily.
There is some habituation that can take place. That's why meeting with providers regularly to kind of update the treatment plan is essential. Higher doses can be considered, but not necessarily. If some folks on the same dose weekly for up to a year or more, and they're doing just great.
What is the closest you will allow to ketamine sessions for the same individual to take place? You said twice a week?
Folks start out doing it twice weekly for 4 weeks, then we stretch it out to weekly, and we kind of remain at that for the foreseeable future.
But have you ever had someone come in where they come in, they get the ketamine treatment, and then they come back the next day and they're like, that felt great. Can you do that again?
Oh, I see. So in the induction course, we generally at least want to have a day in between treatments during that initial induction phase,
Okay.
if not a couple days.
Cool.
Well, if you remember from the last time you were on the podcast, Matt, we like to round things out with 2 questions. Right now, does anything come to mind that you've recently had to learn the hard way?
Oof, for sure. Let's see. How can I phrase this? Something I've learned the hard way. I guess when you're in a situation, you realize the truth is always going to have to come out at some point. And sometimes it can be really hard to deliver, but it's best to do earlier rather than later. Like at some point, you're going to have to deliver the message. That may be vague. It may hit for some, but
Does it hit for you, Diana? It hits for me.
Yeah, it's for me.
I think it hits for all of our listeners too.
Yeah.
Okay, sort of the opposite of that question is what's a life motto or phrase, something that you live by that you've learned from someone else?
so I'm actually going to go to the Matthew McConaughey Oscars acceptance speech from a few years back, where he got on stage and
Yeah.
he remarked that his hero is himself in 10 years. I think about that a lot. Some people were critical of his speech as self-aggrandizing. I thought it was actually kind of beautiful in the sense that he's constantly trying to push himself to evolve, to be kind of his best version of himself, and not to be complacent. And also, I think it's a special lesson in self-love and as well, to kind of put yourself first and invest in yourself. So I think it's an awesome message.
All right. I think it's a perfect place to leave it.
Very good.
You beat me to it, John. Matt, if anyone wants to find you, learn more, where can they find you if they want to work with you, if they're interested in your services?
They can email me.
And what's your
call
email?
me. Sure. Why don't we go with my my private practice email? It's mjmosquera89@gmail.com.
We'll put that link in the show notes as well.
All right.
Great.
Thank you, Matt. Appreciate all your knowledge.
Sip, savor, and live well with new episodes of Steeped in Wellness every Wednesday. Follow our show for free on Apple, Spotify, YouTube, or wherever you're listening right now. Leave your questions and comments below. Find us on Instagram at Steeped in Wellness Podcast, or for more, click on matcha.com.